The reason I went into medicine is twofold. My father has a history of epilepsy, and I dealt with that as a child. Seeing that was quite frightening for a 5-year-old, not knowing what was really going on and what to do if I saw him have a seizure. The second part of that is probably the most important reason why I went into medicine. Is my father had a cardiac arrest when he was 39 years old. Was dead for 10 seconds and was fortunately resuscitated. I was lucky enough to have him brought back, and so I always said I would pay it forward if I had a chance. We see people with strokes from ages 18 to 100. Families, you know, and rightfully so, they want to understand what they can do in the acute setting and what they can do long-term to make their family member better. The big thing is the unknown. I mean, these patients have deficits. A lot of times they will get better, but you can't predict that, and that's what they want to know. Will I be better? Will I walk again? Will I talk again? And I just got to say, you got to trust me on this, and I will say that. Trust me when I tell you this. It seems now like things are hopeless. You're not going to get better, but 30 days, 90 days from now, I guarantee you will be a lot better. As a primary stroke center, we have all the resources at our fingertips that we can do to help patients from the acute setting to the discharge. At York Hospital, we've developed a stroke clinic where we have them come back within 14 days of their stroke to kind of sit them down and go over everything once again, to kind of stress to them outside of that acute setting where they're not really hearing a darn thing you're saying, what we can do to prevent another stroke, what you should do if you have another stroke. What it means for the patient is there's more options to remove that clot, prevent further damage, ischemia, stroke, and get them back to their baseline, get them back to being productive in the community. The bottom line is that you're here to help people. You know, there's nothing better than when I go home at the end of the day, can look at my wife and say, I made a difference today. I helped somebody today. You know, their stroke symptoms are better, they're walking, they're talking, they're having no more seizures, their tremor has gone away. That's why you go into medicine.